This is Jail Talk, the official podcast of the Texas Jail Association. Here is your host, Johnny Jaquess.
Hello, everybody. We're here in San Marcos, Texas at our annual conference, and I've ran into these gentlemen that were in our attendance, and we thought it'd be a good time to have a conversation about what's going on in America's jails and just have a good conversation. Let me introduce you. This is Shannon Herklotz. He is the Tarrant County Jail Administrator and former Assistant Director of the Texas Jail Commission. We have Shawn Laughlin, who is the current President of the American Jail Association and also a jail administrator from Colorado. And then we have Cody Scott, retired Chief of Lubbock County Sheriff's Office. So welcome, gentlemen.
Thank you.
Glad to be here.
So I was sitting here thinking, like, what do we want to talk about? And I want to talk about whatever is important to you. As an association, we have to concern ourselves with, are we meeting our obligations with training? Are we doing what we need to do to prepare our staff in these facilities? Is that, from a national situation, are we addressing the most pressing things going on in the correctional system, and what does the future look like? When I think about that, we'll go to a training event and there'll be like gender responsiveness or some medical stuff. There's a lot of talk about programs of reentry, and there should be, but in my opinion, just to tee this up, we're sort of spinning our wheels and also maybe even catering to this public narrative out there when we can't staff our jails. And unless we start like taking care of our staff, we really can't accomplish much of anything. Anybody want to add to that?
Yeah, I'll certainly jump in. I think it gets back to the old adage of you control the narrative or the narrative controls you. Mm-hmm. Right, and I think you're spot on, Johnny, in the sense that we allow social media, we allow special interest groups that in many ways dictate how you run a jail, and what's the value important of the jail, and we often get lost in these causes, right? Social causes sometimes, an overemphasis on security or lockdown. When we try to look for that balance, where we should be at is, what's safe for the staff is going to be safe for the inmates. That's going to happen 100% of the time. That's just a simple fact, right? But we often lose focus through legislative efforts, I think, oftentimes, that really focus on what's best for the inmates, and we forget about the staff. And the simple fact is the staff have to come in there, and they're in prison in some sense as well, right?
Life sentence.
They're going to be there for 10, 15, 20, 25 years, right? They're doing longer sentences than many of the inmates that they're responsible for. So I think this is a good topic to talk about in the sense that we have to prioritize what's good for staff. And we haven't done that for a long, long time. We've lost our focus in that way because, to your point, if we can't staff the jail appropriately and put good, competent staff in there, for that matter, right? All the stuff we talk about, all the programming, all the reentry, right? All the good stuff that really helps break that recidivism cycle, it doesn't matter. You're
absolutely correct. And I'll tell you, Cody, I got some research on staffing from National Institute of Corrections. That's where I found some research that says that correctional staff have the highest degree of PTSD of any known profession, including the military. And I thought that was very interesting, and so I started thinking, well, where does that come from?
Well, and Johnny, when you think back when you first started, when we first started and you walked in, you didn't have any training on what you were going to be seeing. And a lot of times it's a shock. It's a shock to your system. You're young, you're impressionable. I was 21 when I started. And, the things you see in the jail, you see life and death situations many times. You have to deal with death as an officer in there. And especially back then, there was no support for that. It was just, suck it up and move on. And we've got to recognize the traumas that come with the job, and be able to help our staff in dealing with those traumas. And that's what that's about.
I thought it was interesting in that also the source of stress. We think about PTSD as like, we saw something traumatic, and they do. Fear of being assaulted or actually being assaulted, that does happen. But I thought was interesting is the stress in post-traumatic stress comes from micromanagement.
Oh yeah.
It comes from managing large number of inmates, very few breaks, torment from inmates. When I was teaching, I think it was a wellness class, and I heard this in more than one class. The participants were saying, yeah, you know that we have electronic rounds trackers, and they get alarms that go off, and you don't really think a whole lot about it. We have to document that we had face-to-face contact with all of our inmates periodically. And we're probably the only profession that does that. I don't think teachers have to go around and make sure they looked at their kids, you know, or I was talking to some folks that work in a hospital. They don't have to check on their patients like that, but we are heavily micromanaged in that regard. They said they were waking up in the middle of the night after a nightmare because they thought they were late on their rounds. Because there's no, and you used to work for jail standards. I mean, what forgiveness is there in place for if we don't document that we had face-to-face contact?
And that's a good point. And one of the things that brings to mind is we go to the commission meetings. They have the quarterly meetings, and you know, I've heard people get up and say we're 98.5% compliant or we're 99% compliant. That's well and good, but the standard says you've got to be 100% compliant. And so when you're talking about making those rounds, I'm all in favor of the electronic devices and all the tools that are at our disposal. But part of the problem is, in talking to the staff, they're so worried about being on time that they're no longer doing good checks.
Yep.
So you got to find that balance of being on time but doing a good check, and it's hard to do that. And y'all brought up the staff and being short of staff. You know, these folks working tired too. That's when they make the mistakes. And so, you know, I took a class a couple weeks ago with several of my staff, and I'm just sitting in the back. They didn't realize who I was or where I was sitting, and you hear the honest conversations. And one guy told me he had been forced 3 or 4 times that week. This was spring break week, and I mean, the poor individual looked like a zombie. So again, we got to find that balance of safety and being staffed, and you know, it's one thing to meet the 1-to-48 ratio, but it's got to be healthy. And if we're not letting our people get the proper rest, then the PTSD kicks in.
Right.
Those things that we're just y'all talked about, they come into play.
Well, let's talk about the ratio, for example. You know, if like I often have talked about this analogy, if jail was a classroom, because the public expects us as a jail to teach them a lesson, but we don't have a lesson plan. You have one officer and 48 inmates, and half of them are going to have a mental health diagnosis. About a quarter have serious mental health issues. These are feral people that get brought into jail, and then you have one office and the most unhealthiest population. They're doing God knows what with God knows who, many of them, before they come to jail, and they're sick, and you know, there's behavior problems. And then the officer may be 18 years old, might have been a truck driver 6 weeks ago or something like that, and they're managing all of these people, and then we wonder why things happen in jail. And so I think this is important for us to talk about, because the public, you know, the jail is out of sight and out of mind for most people. It's an afterthought in the criminal justice system even. And I think it's because, you know, the public, they get their opinions because they really just don't know. If they knew what was going on in jail, I think they'd be more sympathetic, you know, when because they only hear about things when somebody dies that's controversial or something like that. You know, there's a use of force situation, or like Netflix, these other shows, like, you know, these series that you watch. They're giving the inmates' perspective, and oftentimes they paint the correctional staff in a bad light. And it's like, well, maybe we need to tell our perspective, but that officer looks like they're tired, because, and you know, I'm sorry that, you know, he didn't give you your lunch on time or something like that, and they make it, oh, that officer doesn't care about us. Well, they have 72 of them potentially. But going back to these ratios, you working at jail standards, I don't know where 1-to-48 even came from. Where are the studies on this? And now with the increase of mentally ill people coming into jail, and we're the de facto mental health institution, I think it's too much.
Yeah. I would agree. We we get so fixated on the staff to inmate ratio, right? Because it's an easy, clean benchmark that we can look at staffing numbers, right? Ratios. But the simple fact is, you look at most facilities, and to your point, right, half of them coming in right out of the gate with some underlying mental health issue. Up to 3/4 of them, right, and then up to 80% will have co-occurring disorders, addiction issues, right?
Yes,
so when you
right.
throw that combination together, right, the ratios are irrelevant at that point, right? Because you're dealing with a human life who's in crisis, right? And to your point, you take an 18, 19, 21-year-old, right, fresh out of the gate, and I don't care how robust your training program is, whether it's 2 weeks, 10 weeks, 12 weeks, 6 months, right? Yep. You're basically asking them to be a social worker, a crisis counselor, initial firefighter, because we put fires out in facilities, literally, not just figuratively, every single week in our facilities, right? Yes. Whether it's a dryer or a kitchen or an inmate ARC and an outlet, right? So we ask them to be and enforce laws, right? We enforce laws inside there, right? The police officers out in the street, they don't have the time to come to the facility. So who's doing that initial triage of that criminal incident? The detention, the correctional officer is. Yep. So even in the most robust 6-month program, there's no way you can prepare somebody to do that, and then you're entrusting them with another human life, and we create this libelous situation where we can be sued, right? Next to football, right? It's the second most popular pastime in America, right? Is litigation and corrections.
That's right.
And you've said it many times. I've heard it, Johnny, right? Sheriffs don't get elected because of the jail, but they sure can become unelected, right?
Right.
Or end up on the 5 o'clock news because of the jail. Because unequivocally, it is the highest liability of any county function is a jail. But we don't really do a good job of expressing that value, and then therefore we don't get the resources that we need. So I think you hit the nail on the head. It comes down to we don't do a very good job taking care of staff because we don't tell our own story.
Well, and part of it is we don't give them the respect they deserve. These correctional officers, that is a tough job. We talked about some of the statistics, but I even looked internally at my own organization on workman's comp claims, because I had a politician tell me, "You can't tell me that's as dangerous as a street cop because you don't get shot at." And I was, well, we don't let guns in there, so yeah, right. Probably low incidence of getting shot, but 90% of a sheriff's office workman's comp claims probably came out of that jail. I know they did at mine, and like most of those are from fighting and restraining inmates. Right. So the dangers are there. There was a death in Texas recently where, one of the officers was tragically beat to death by an inmate, and these things need to be talked about. I do think, because nobody says I want to be a jailer when I grow up, and a lot of it has to do with they don't even know about it, or they get hired so they can maybe go to patrol. They just don't get the respect that job deserves. I think that plays a huge role in the gaps of the numbers in terms of staffing and retention.
Agreed.
And Johnny, I don't know to get off the topic, but go back to the ratio. So being at the jail commission for as long as I was, a lot of those numbers were arbitrarily come up with. I think it started off as 1 to 50, and then somehow it dropped to 1 to 49, 1 to 48. And I get exactly what Shawn's saying, and I agree that those ratios really, they're really just a guide, but I can't speak for Colorado, but I know in Texas, if you don't have those ratios, you guys know, especially Cody, you and Johnny, y'all worked in the jails. If you don't have those ratios, the court is not going to fund you to those ratios. Now, there are standards that allow you to go above and beyond, but getting the support from the funding sources, that's where the difficulty comes in. And I couldn't agree with you more. I mean, we've got some areas of our jail that probably need to, be 1 to 10. Right.
Yeah.
1 to 15. I don't know the exact number, but trying to get all of the stuff that's required by the legislature and the law, and to try and get it done in a certain amount of time is almost impossible. And I'm new to Fort Worth and Tarrant County, but some of the things that I try to impart upon my staff too is don't back ourselves in a corner with a policy, right? Because we tend to I don't know what the term is, but we have too many policies that back us in the corners where we don't have any recourse anymore. Right. We're bound to do certain things that we can't accomplish. So we're the victim sometimes of our own processes.
Well, so you're going to get the blame when you have people die in your jail. The sheriff is going to get the blame. But I tell people, we don't want anybody to die, and we don't want bad things to happen in our jail. Nobody does. But we're gonna take the fall or get the blame, and it goes back to really these resources. You would have more staff if you were funded for it, right?
Correct.
We all would, because we see the need. But politicians do not want to spend more money of the public's money, and so to your point, without having a law that says you must have this many staff, it's not going to happen. At least not in most areas, and I suffer from that as well. It's always a fight, begging for resources, almost like you're going to commissioner's court with your budget, and you got a sign that says anything helps and a tin cup. And it's like I'll take what I can get, but just don't blame me when somebody dies.
Correct.
Because you're already dealing with the most unhealthy people, and so we're adding on to our facility a medical mental health addition, and so I worry about what does a hospital have in terms of how many clinicians do they have for their patients? And that's something that we looked at. I don't know if NIC's done any studies on that, but that would be something good. But back to these ratios, I don't know if I'm unaware of any national ratio. I don't know. What do y'all do in Colorado?
It's not statutorily set, so it's going to be the standard rule. Most of the county sheriffs is about 1 to 50, 1 to 48. So, so it's pretty standard in that sense, and it can be used as a funding mechanism, right? No different than a patrol operations. You use a ratio per number of citizens, right? Full-time citizens. So I think that not to belate the point, right? We've got so fixated on that ratio, right? And to your point, Shannon, we backed ourselves in a corner with respect to it's not really about the number of inmates; it's the type of inmates, right? And then we can then quickly gloss over, well, your ratio is being met. It's like, well, that's true, but I'm still processing 3,000 people a year, and 2,200 of them have a serious mental health or addiction issue.
Yes.
And I might keep them for 6 hours. I might keep them for 2 years.
There needs to be some more research. Perhaps this would be a good topic for NIC. I do think we need to go towards a classification model for ratios. And it's hard to say, so many per dependent, is how do we call out the special needs inmates? How do we call out the more intense, inmates that need to be more intensely supervised, and in a way that makes sense? Because we have if you're going to do that, does the jail design, that complicates it? Because if we're going to change the ratios, then you have to look at what facilities we have. You may not have the space to be able to do that.
Correct.
So it's a very complicated issue, but it's great that we're talking about it. Anyway, do you know of any other research going on?
I don't. I'm relatively new to NIC, so I'm not familiar with everything, but I can definitely check with our resource center and see what current research there is available for sure.
And I don't want to get off topic again, but to go back to y'all's point, Shawn's point, when the ratios were set, we had minimum, medium, and maximum security inmates. How many minimums?
Right.
How many minimums do you have in your jail?
Right.
I have very few, and that's for whatever reason, bond reform, bail reform, some of that has to do with that. But most of my guys, that I have females in jail, they're serious offenses. The low level offenses aren't coming to jail anymore. So a lot of these ratios, these arbitrary ratios, they don't apply anymore.
Right. You're absolutely correct. It's interesting when it's eye-opening for the public. When we give tours, we talk about it. They really don't know. But let's talk about mental health for just a minute, because that does influence these. The stress on the jail. There's no simple max, medium, all that stuff anymore based on charges, because the public in general think there's two types of people. Like I would say, two types of public. There's the lock them up and throw away the key. There's a victim to these crimes, and these are bad people. And then you have the other more sympathetic side. So, well, most of these people are just made a bad decision. They were raised in bad environment. I tell people they're both correct.
Correct.
We have all kinds in the jail that come in that have a lot of problems. And then you have some people just made the worst decision on the worst day of their life. So we have to sort through all of that. And so I think the classification system is antiquated. I think we should go back and there needs to be more research on that. But I think it starts with conversations like this. That maybe we can educate the public. I know our association is producing a number of videos. I know now AJA is looking at making some videos.
Yep.
I would like, and NIC as well, or the Justice and Support Center, Jail and Justice Support Center is making videos. So hopefully we can start educating the public and getting the word out. What would y'all think about making like a documentary maybe we could put on Netflix or something?
No, I think it's way overdue, right? And if you look at the crux of the matter, really does come down to, like you said, you get two camps, right? And I think every environment or every neighborhood struggles with this, right? It's limited tax dollars, and the simple fact is, you have two models, right? You have the traditional corrections model, right, which is we're tasked with correcting that behavior, fixing that behavior, but not giving enough resources to fix the behavior, right? We're trying to intervene on that sort of free will choice to make decisions. Like you said, sometimes it's just a bad decision on the worst day of their life, right? But we're responsible for that human body at that point, right? And the other side, you got the other camp, which is fully embrace rehabilitation, right? And those camps socially are quite opposite of each other, right? It's just like in politics, right? It's hard to find something in the middle, right? But facilities have to be very agnostic in that sense, where we have to embrace both sides of that, correct? Because are there individuals that made that terrible decision and definitively are going to go to the Department of Corrections for the rest of their life? They are. So they're not returning back into society, right? But in my facility, about 97% of them, so 97% are going to return back to the community they just came from. So people always think about that out of state, out of mind, right? So they got arrested, paddy wagon shows up, go to the jail, never seen again. Maybe you see it on the 5 o'clock news and that's it, right? Simple fact is only about 3 to 5% nationally actually go off to a prison system, state or federal prison system. So the question becomes, what have we done to intervene for the other 97% to keep them from coming back over and over and over again? And without resources, right, thrown in that way, just like you throw resources to patrol operations with radar systems and traffic control devices and other things you could use to enhance public safety, right? Motorcycle units, SWAT teams, Bearcats, all those things you use to enhance public safety. We don't, unfortunately, adopt that same mentality in a correctional facility of how can we interdict and stop crime from coming back the next time? Because as you point out, Johnny, for every criminal we have, or alleged criminal in our facility, there's one or more victims, right? And we lose focus of that, right? We want to focus on punishing the criminal, and in some models we want to rehabilitate them, but not give the resources. So if every time we can break that cycle, that's 1, 2, 3, 4, 20 different victims that will not be victimized in the future.
Absolutely. Who are we releasing back in the community?
Right.
If I could sober up in somebody's father that is abusive or something like that, because that child that grows up in that household, if your parents are addicts, you don't have a chance, really.
Correct.
How do we interrupt that? And what's the ripple effect from that? And also think if you're running a lot of programs in your jail, that it adds value to that correctional officer. I think you have to be sort of careful with it. You don't want to put a whole lot more, anything more, on that single officer in there with a number of inmates. But the studies have shown that if you're running a program jail, you're getting better outcomes, and then the violence is going down in the jail. Because you think about it, going back to that classroom analogy, if their nose is in a book or they're learning something that or doing something that we have them do, then we're not leaving it up to idle mind is a devil workshop, as they say. And so that's where a lot of the these things come from. And going back to that classroom analogy, if you had one teacher, and the stats show this would be a special needs discipline class if it was in a high school or something.
Oh, yeah.
How many teachers would be in there?
Right.
And then you would have a lesson plan. So if you had 72 special needs students and one teacher, what kind of bad stuff would happen in there? And who would want that job? Who would and then not get any credit?
Correct.
It's
For any success.
And then when something bad happens, they get sued, and it's like, oh, it's a disaster, and jails are no different.
Yep.
Programming is a relatively recent thing for jail systems. The old school mentality was when they go to prison, they get corrections. They get the programming there. In jails, not so much, and a lot of it was because of the short time frame that they spend in jail. But I think over the last 20 years, and I'm going back, I was in a meeting when I first became a jail administrator, and it was large jails from across the country, and some of them were talking about programming in the jail, and then some of the sheriffs and administrators were adamantly against it. That's not our job, that's not what we do. But over that period of time, you've seen that evolve because people realize, like you said, these folks, 97% of them in most cases are coming right back into our community. And we don't want them coming back as an educated criminal. We want them coming back as a changed person and changed for the better. And I think, in my opinion anyway, that's a responsibility that we have. When they come to jail, they sober up. They're off the drugs. They're thinking more clearly. And if you provide them the resources to make some educated changes in their life and show them how to do it, then that opportunity is there for them. And Johnny, in our jail, when we worked together, we had some fantastic and very successful programs where we saw changes. And we were able to take people out of restrictive housing, and it was all voluntary, but they took the programming and they changed their behavior and became mentors to others in the jail.
Right.
And they took what they learned and they spread that education to others. And I just feel like that's a responsibility that we have as administrators, is to be able to offer that to them. Is everybody going to take it? No. Everybody, it's like college. Some people are ready to go to college when they're 18, and some people aren't ready until more midlife. And so they have to be in a position where they're ready to make that change for themselves, and their family sees it. We had a highly successful GED program. I think to date still the only one that can test inside the facility and get their GED diploma. Can y'all do that now?
We can do it now.
Okay,
Yeah.
so we were the
That's
first.
rare, though.
Y'all are the second.
That's still rare.
Yeah.
But, providing them those opportunities, and the GED program was our most successful to stop recidivism, because they had that piece of paper that they could show that they were successful at completing their education at a certain level, and it helped them get a better paying job and basically change their socioeconomic place when they were out of jail. And those are the home runs that we can hit, and it's not going to be with everyone,
Right.
but for those people, they need that opportunity.
Yeah, and some of the reentry programs and stuff that we do, I know we make a big spectacle of it, right? We invite community leaders, and some of those guys will come up and tell you that's the first time somebody's ever believed in them.
Yep.
True.
And and they're tied back to community resources. A lot of them leave there with a job, and that's something they've never held before. So if you help one individual, well, it's worth it. When you start touching multiple, then your recidivism rates start to drop. So,
Well, it's not hug a thug.
No,
That's what I
it's
tell
not.
about.
Right.
When we're talking about this with a pup, it's like we're not talking about being soft on crime. Really, it's the opposite of that. It's not a left thing. It's not a right thing. It's a smart thing. We're not talking about reducing sentences and things like that. I'm saying we got to get away from human storage, just warehousing people.
Yep,
So what do you do in this time frame? They shouldn't just be allowed to lay around in their bunk all day or play checkers and dominoes or mess around on a tablet or learn how to be a better shade tree pharmaceutical salesman from their cellmate.
Yeah.
Because if we're not teaching them, that's who they're learning from. If you look at a pod in a direct supervision jail or a linear jail, who's there with them? We don't have the time to do that. So we have to bring in resources. We have to be intentional about teaching them. And I'm reminded of what I was talking about this when my colonel, when I graduated boot camp, was talking to the parents. He said, Despite popular belief, we haven't brainwashed your children. We have simply taught them where you have failed. And that's what's going on, is we have to teach, frankly, we have to teach people where their parents failed, or maybe they didn't have parents. They got their own issues. We talked about PTSD, but do you get PTSD from being raised by crackheads and getting cigarettes put out on your forehead and locked in a closet and these sort of things?
Yeah.
So, we have to, and even like we complain about the modern workforce and how they don't have the same work ethic and stuff.
Right.
It's the same thing. Character can be taught. How to do life. We have to be intentional about helping these people have a better life and reduce the victims that are out. I mean, it just makes sense. We're preventing victims. There is a public safety component to this. Real quick, I do want to mention, because I know we're running out of time, the lack of resources out in the community. The public is not necessarily aware of all this. But we know jails have become the de facto mental health institution because there's not long-term mental health hospitals. We don't have that out in the community. So when the public sees these people on their streets, or if there's somebody with strange behavior on their lawn, they're going to call the cops. They don't understand. They just say, strange guy, person, naked man in the park,
Right.
Call the cops. We're the only country that arrests a naked man in the park. They go to jail. Instead, they'd be surprised. There's no resources out there. So that's really
That's
what
why
a lot
they
of
go
what
to jail.
That's
Yes,
why
There's
they
no
go to
other
jail.
option.
There's no other place for them to go.
Yeah.
If you're mentally ill, serious mental illness, it's like a 90-something% chance that person will be incarcerated. And it's like arresting somebody with a broken leg because there's no ER to
Correct.
patch them together.
it's a
and then
default.
our staff have to deal with that.
Right.
So it all makes sense to have all of these programs in place in jail, quit warehousing people, and then, it's just not so simple as lock them up and throw away the key. It's a public crisis. And look at these mass shootings, by the way. Last point. Is there not a mental health component? With all untreated mental health is a public crisis. And
sure.
when they get locked up, they may not have all the resources to get them stabilized just in a correctional setting. And it's not appropriate.
Correct.
Any final points that everyone would like to make?
One thing, we all come from large jails, 1,000 beds or more in our facility. But and it's easier for us to develop the resources because we're in a bigger populated area. But what about the small jails? There's more small jails than there are large jails.
Absolutely.
And they have
Correct.
minimal resources.
You're right.
So, that may be a topic for another podcast, is bring some small jail administrators and sheriffs in and find out how they deal with these same issues. Every community has the same issues, different scale, same issues.
Right.
So, we're fortunate. We have universities nearby that we can clue in as resources. There's large mental health facilities around us, hospitals that can help us with different issues that we have as a large jail. But what do the small jails have?
I'm glad you said that because I was thinking about that because we got 24/7 MHMR. We got 24/7 medical. And in Texas alone, there's 240 facilities or about that. Half of them are under 100 beds still.
Right.
So what are the 10 beds, the 24 beds, the 48 bed jails? If we're seeing these challenges, I can only imagine what they're facing.
So, I do think that programs and reentry is the future of corrections. You mentioned bail reform, this sort of thing. I think the best thing that we can do right now is programs and reentry. That's why this association created a programs and reentry committee to focus on this stuff. And part of that is small jails. We want to make sure small jails are represented in that. And I think we can do a lot of things remotely. We as large jails use a lot of volunteers. Those communities can use volunteers for some things as well. I just wanted to say that we are intentional and we're about looking at the small jails and bringing those resources.
Yeah, it's certainly from AJA standpoint, right? A huge group, as you have pointed out, is small and medium-sized jails.
Yeah.
Don't have the resources, standalone resources. So you got to get more creative. It requires a higher level of collaboration. I mean, if you're a jail administrator, or you're a county commissioner, you're a city manager, county manager, whatever your funding authority is, and you're sort of that top echelon of the decision makers, you should be going to your county jail administrator and asking them or her, right? What do you need? Right. The simple fact is, if they tell you that they're the largest psych eval numbers in your county, that's bad. If they're telling you that they're giving out more medication-assisted treatment programming in the county than anybody else, that's bad, right? Mm-hmm. It's good that they're doing those programs and making those assessments, but the simple fact is that's so far downstream, right? We're not going to have much of an impact on public safety. And ultimately, that's really what it's about. Is public safety and ensuring that victims are not either re-victimized or new victims happen because of our failures inside the facilities in addressing these issues. Can't do it without assistance. But the simple fact is, what I just said is a fact for most jurisdictions. In my county, and I am very well funded, very well supported, I give out more medication-assisted treatment medications in my jail than anybody else in the county.
Wow.
And that should just not be the way that it is.
Well, and there shouldn't be, like when we talk about resources, and that always comes up with smaller facilities. Well, why? You know, is it access or is it funding? You know, so I think that should be.
I think
looked
it's
at.
both, and it's also the mentality of the county.
Yeah, that's
and the
true.
county officials.
That's true.
You know,
Yeah.
they're just, some of them are not as ingrained with what's going on. Really,
They're not as
To be-
plugged in.
yeah, that's a good term. Not as plugged in.
Yeah.
And that's no offense. I mean, the smaller
Sure.
counties, they have other problems that are more pressing.
Right.
So
Well, listen, it's been a great conversation.
Indeed.
Thank you for participating. You know, it's good that we're getting the word out and we're starting to talk about these things, and hopefully it helps. You know, we as leaders in this industry should be influencing. You know, because the public should be listening to us running these facilities instead of getting their message from Netflix or Facebook. Right. All right. Well, thank you all very much.
Yeah, thanks,
It's
John.
been a
Thank you.
pleasure.
This has been Jail Talk, the official podcast of the Texas Jail Association. To learn more about the Texas Jail Association, visit us at texasjailassociation.com.